What are some of the policy or plan concerns I should have if I'm looking to buy my long-term health care coverage through my employer? A policy or plan offered by an employer is governed by a federal statute called the ERISA statute. It's not a friendly statute, and it can become problematic ultimately if you have to file a claim. But while you're looking at the benefits that an employer-provided long-term health care policy provides, I think you should be looking at the following. One is the elimination period, how long you have to go without having them pay for the benefits. You still need the care, you still have to pay for it, but they don't pick it up till maybe 30, 60, 90 days or more. Number two, when do you have to file a claim? Is it when you first starting getting the care at a facility or when a relative starts providing the care? Number three, how much is that care going to be paid for or reimbursed? There are two kinds of policies potentially. One is a pure reimbursement policy. One is you get like a lump sum of money every month, and once you spend it, too bad, so sad. Another factor is where is that care going to be provided? Do they have to be a licensed facility? What are the nature of those qualifications for any potential facility you're thinking about you might go to? The other thing is the qualifications of the providers. What's the licensing requirements of the particular provider? What type of training do they need to have? Another one is there might be what's called a coordination of benefits provision in your long-term health care policy that says, hey, if you've got long-term care coverage through another entity, or maybe potentially you can get some of this through Social Security, they're going to be primary, and this policy, employer-provided policy, is only secondary. That can leave you short, if you will, of coverage, and you potentially have to repay coverage. So you also need to understand that there's this one other clause that I alluded to in the beginning of this video, and that is the ERISA statute uses a standard of review depending on what's in the policy or plan language that says that we, the long-term health care provider, have the discretion in determining your entitlement to benefits and the amount of those benefits. That makes it very hard if you end up in front of a judge to convince the judge that the disability carrier or the long-term health care policy was wrong in denying your benefits or terminating your benefits. I call it the get out of jail free card. And it's a handcuff on a federal judge in determining your entitlement to benefit. That's one of the many terms that you should be looking at when you're looking at an employer provided or employer sponsored plan. Just because your employer says, hey, we're offering it, doesn't necessarily mean it's the best thing for you or your family. If you have any questions about your policy or plan, or if your claim has been denied or terminated, regardless of where you live in the United States, give me a call today at 727-894-3188 for a complimentary consultation. I look forward to helping you get the benefits you deserve. 727-894-3188.